Today I'm speaking with Timothy Wood from the School of Nursing, University of North British Columbia in Canada. Welcome, Tim.
Thank you very much.
And you've recently published a paper with Rural and Remote Health titled Factors Associated with Teletrauma Utilization in Rural Areas, a review of the literature.
That's right, I did. Yes.
I wonder if you could tell us a little bit about the research team to start with.
Sure. So I had a great team going into it. I'm an early career researcher. So my team was fantastic. That included two assistant professors with the School of Nursing at UNBC in Canada. That's Dr. Davina Banner-Lucaris and Dr. Shannon Freeman. And then we also had a professor of geography from our school as well, Neil Hanlon, and then Melinda Martin-Kahn from University of Queensland, and she's with the Faculty of Medicine. And we also had a Northern Health Authority partner, Frank Flood. So we had a great team going into it.
Brilliant. And so, how did your study come about, and what is teletrauma?
Yeah, that's a good question. So it's really telehealth services being used for trauma situations, trauma and emergency situations. So particularly in Northern British Columbia, we have this very unique health service delivery problem, which is that we have a small population in British Columbia, Northern British Columbia, but the geography is incredibly dispersed. So over about 600,000 square kilometers, there's only about 300,000 people. So very few people living very far apart from one another. So that creates these challenges for health service delivery, particularly in cases like trauma, when you need very rapid access to care and expertise. So it really came from a place of wanting to understand more about teletrauma systems in general and how they work and how they're used in rural areas, like even, for example, Australia has some similarities as well. So that's kind of where it came from, is trying to better understand how it functions in rural areas and why people are using them.
So what did you find?
Yeah, we found some great stuff. So we found that teletrauma systems were utilized more for patients who were younger, patients who had penetrating injuries, so that can include gunshot. They are also used for those who were more physiologically deranged, or they were more ill, so they are sicker patients. And one of the more interesting, perhaps non-clinical side of it is that teletrauma was more likely to be activated by physicians who were less comfortable in trauma situations or didn't have a lot of experience dealing with trauma. So a lot of it was fairly intuitive, but it's nice to see it backed up in the data. Yeah.
And so what comes next for this kind of research? When you were speaking then, I was thinking about exactly that, how rural health care providers might be placed to do telehealth or teletrauma. Do you do teletrauma?
Yeah, you can do teletrauma. Absolutely.
Use teletrauma.
Yeah.
Yeah.
Yeah. So the real next steps for this would be examining. I mean, we have the data for why teletrauma is used. Some of those clinical factors, some of those organizational factors. We know why institutions choose to use teletrauma, because they're very far apart from other services, or they don't have, trauma surgeons, for example. So they'll opt for adopting a teletrauma system. So a next real step, specifically in our case in Northern BC, would be to speak with people who've used teletrauma and really understand their experiences and kind of see how that lines up with the data or how it doesn't line up with the data. So that could be an interesting next step. And then taking that a little bit farther, it might be useful to design data collection systems kind of around some of those findings and what we've been looking at and why teletrauma is associated with why some of these clinical factors are associated with teletrauma use, and then looking at primary data for a teletrauma program and examining it from that side. So of course it's got to be very data driven, but you need that high quality data to begin with. So that would be an intermediate step think that's where we want to go with it. And, just moving on from that, the real implication for that is that you begin to develop teletrauma systems that can be used very judiciously and efficiently in rural areas where they don't have a lot of resources. So if you're working with communities or with small hospitals that don't have a large operating budget, they can't be using services for anything and everything that walks through the door per se. So they would really capitalize or make good use of perhaps a screening tool for when to use teletrauma based on certain clinical or organizational factors. So those are definitely some implications that could come from it.
Fantastic. I look forward to hearing about what happens next in this space. It's really fascinating.
Yeah, it is.
Terrific. Well, thank you for talking with me today and best wishes.
Yeah, of course. Thanks a lot, Melissa.